Colleran with St. Vincent Heart Clinic, Arkansas, joins us today to talk a little bit about hypoglycemia and the risk of cardiovascular disease. So good morning. Thanks for being with us.
Good morning.
Let's talk a little bit first about what those two things are. Some people don't really know that.
Well, cardiovascular disease in this study looked at people that had heart attacks, strokes, or cardiovascular death. Diabetes, of course, a lot of us know, is abnormal blood sugars that are too high. In this study, they looked at patients that were taking insulin.
Well, tell us a little bit about the study and what all it looked into.
The study actually was a large cohort study that was done in England,
Okay.
and they culled data from the national healthcare system. And what they did was they reviewed patients that had diabetes, both type 1 and type 2, and looked at hypoglycemic events to determine whether or not cardiovascular events occurred in these patient populations.
And what were the results?
Well, usually there's a high risk of cardiovascular events in patients with diabetes. However, what was interesting about this study was those patients that had hypoglycemia had a significant increased risk of cardiovascular events or disease. What they noted was there was a 92% increased risk of cardiovascular events in patients with type 1 diabetes and a 50% increased risk of events in patients with type 2 diabetes. There was twice as likely a chance of death within a year in both groups.
What was the reason for that increased risk?
Well, the investigators postulated a variety of mechanisms. One was possible changes in the electrocardiogram, and the other was changes in blood pressure due to catecholamines, inflammatory changes, or endothelial dysfunction. However, that could only account for events occurring at the time of hypoglycemia and not for events that were more long-term. The potential possibilities for long-term events may be different, and we're not really certain why they occur.
There are always going to be some questions. What are some of the limitations that were involved with the study?
Well, the study was what's called a retrospective study. It looked back on a large database.
Sure.
It's not a study that was going forward following patients, so there may have been inaccuracies in the data, possibly. However, still, due to the large amount of data available, it was a pretty respective study.
Yeah. So what can we do to change the outcomes of patients who develop hypoglycemia?
Well, first of all, we want to try and prevent hypoglycemia from occurring to begin with. Typically in diabetics, we want good glycemic control. We want to normalize their sugar as much as possible. However, in those that develop severe hypoglycemia, they may be at risk for events. So things like close monitoring, as well as possible cardiovascular testing in those people that develop hypoglycemia may be beneficial.
Are there any other factors that go into it as far as preventing it?
Well, yes, and these patients once again took insulin, and typically, once again, we want to try and control the diabetes and get the blood sugar, not necessarily normal, but as close to normal as possible. However, if we overshoot and the patients become hypoglycemic, that may potentially cause problems.
And of course, there's different types of diabetes. Is this one of those situations where if you can get it under control, you maybe put yourself at a lower risk?
Well, in general, you may, as long as you improve the control of diabetes, you may decrease cardiovascular events. However, what this study was showing was that if you got too low and developed severe hypoglycemia, you may be at risk for higher or increased events.
Interesting. So what does this study tell us? For anybody out there who says, you know, that might apply to me, what should they take away from this?
Right. Well, first of all, I think you want to see your doctor. You want to make sure that you're monitoring your blood sugar. Most diabetics that use insulin are monitoring their blood sugar. And you potentially may want to see a cardiologist if you've had an episode of hypoglycemia in order to do further cardiovascular testing.
Absolutely. All right. Well, thank you so much for the information. Very informative study. And if you guys have any more questions, Dr. John Colleran is at St. Vincent Little Rock, the Heart Clinic in Little Rock, and you can see the phone number on your screen. All right. Stay with us after.